Good morning. Good morning. We call this meeting of the Virginia Commission to End Hunger to order. And if the clerk will please call the roll.
Thank you, Madam Chair. Delegate Price,
Here.
Delegate Anthony, Delegate Cousins, Delegate Owen, Delegate Taylor, Senator Rome, Senator Pekarsky, Senator Craig, Pamela Irvine, Dr. Vivica Craik, Ipiana Spencer, Terrio Williams Ford, Eddie Oliver, Jennifer Montgomery, Rakia Fagans, Robin Robbins, Dr. Andrea Timmer. You have a quorum, Mayor.
Awesome. Thank you all so much. And I understand that some of my colleagues are pulled in many different directions at this time of year. So we appreciate everyone that was able to show up, and we might have some members to join us online. But just a reminder, they are not able to vote and do not count toward the quorum. But we do have a quorum here. And so we want to welcome everyone and thank you all who are watching. We are coming up on a few important deadlines, but one is making sure that we are having an impact when it comes to the legislative proposals that we're going to put forward or recommend for some of my colleagues to carry so that we can start enacting legislation that will help toward the ultimate goal of ending hunger. And we will have a presentation, but just got reminded that that will be a little bit later. So we will jump into our discussion and consideration of commission recommendations and legislative proposals. A few of my colleagues are coming in, and I'd love to see it. So I'm trying to, the setup of the room is not as great, but I'm trying to look at Julia and Hannah to remind me, am I walking through this, or is it the chart that you could walk us through on the different types of proposals?
Thank you, Madam Chair.
Thank you.
The chart that each of the members have in front of them is sort of a template to show them how sort of the general format that recommendations are to be made in. The examples are pulled from topics and subjects that received a lot of positive attention in several of the previous meetings of the Commission. This is a reminder that members have full discretion to make the final recommendations. So none of these examples have to be used. You can disregard any of them. You can add any additional ones. You can modify any of them. This is just to sort of refresh memories and guide people on the to sort of frame their thinking and their recommendations. We also tried to frame them in the various ways that legislative proposals can be framed to get some of these things done. For example, the first one in the brackets in italics, it could be a pilot program or an initiative. The second one, direct an agency to establish a work group, and so on and so forth, just to sort of help particularly those members who might not have had an opportunity to be on this sort of a group before, to sort of help guide them in seeing that the technical specifics, there's a lot of ways to get these things done, but the main idea is to have a focused idea of what exactly it is that you want to accomplish in making that recommendation. And then the column to the right includes sort of the background from where these ideas, these examples were pulled. In the final version, we will also include that information. And then the last two columns will be filled in after the final recommendations and the votes are made, if possible. So again, just a reminder that these are just examples that came up a lot that we pulled to try to sort of refresh memories and guide conversation. Members can but need not use or modify any of these and can make any additional recommendations that the Commission sees fit.
Thank you so much. And so for our civilian members, you are already making a difference just by asking questions, because it's being captured in some of the proposals, your ideas, your passion points. Also want to remind you that on our website, we have the outline that was done for us for October 22nd, and that had a lot of the ideas from other states that we were thinking about and hoping to come back to, either have more questions answered or to just refresh your memory for some of the things that we have already discussed. The PowerPoint boiled it down, but the agenda outline had a little bit more. We've also have wonderful definitions that have been offered to us for food desert, food insecure, and nutritious, and reminding folks that if there are definitions of words that are needed, let's say we're doing a legislative proposal and the definition does not already exist within code, that can be part of the bill for us to define the term, because as we know and have seen in our conversations, defining terms helps us all know what it is that we're working on. So with that in mind and looking at some of the draft recommendations, does anyone have any questions before we dive into the discussion? Dr. Craig.
Thank you, Honorable Marshall Price. I just had a question about the proposed legislation. Can we propose amendments to that as well? For example, the first one, I saw that there was this General Assembly should consider passing legislation for the food desert, food insecurity mapping. But what about food policy councils, coalitions? I had a master's student at Virginia Tech a few years ago who actually did that for her master's degree. I'm happy to share that information, but I think that might show all the groups across the Commonwealth of Virginia that are addressing the problem.
Yes, absolutely. So just a reminder that whatever you see in front of us is just the floor. The sky is the limit. So if you wish to reword that in the form of a motion, an idea, please, we are taking notes, and so we can move forward with that, adding any idea that we haven't even discussed and starting the discussion for that today. All of that is well within the confines of our meeting today. And also, reminder, we don't need to reinvent the wheel. So if you are sitting in your chair and bring wonderful information and assets and resources, please let us know, and we will see how to best use that. And for those that might be just tuning in for their first meeting, because we just got started this summer, some of the legislative proposals that we'll have for the 2025 session, no disrespect to the issue at all, but might be lower hanging fruit because we might need a little bit more time to research and flesh out some of our larger ideas. But that doesn't mean that we can't try if there's something that's already been researched. It just needs to be brought to our attention. Any other questions? Ms. Robbins?
Thank you, Delegate Price. Thank you, Delegate Price. Could any of these include the app that we had discussed and the exploration? I believe that we would be able to get that from a university level without cost, so it would not have a negative fiscal budget impact.
Yeah,
which would serve attractive.
So I'm going to ask Julie and Hannah for that, the different types of ways we could do the Section 1 bill for directing a public university to look into something, what are some of the different ways that we might be able to get to the app part?
Thank you, Madam Chair. So for any of these, there are various ways to accomplish and direct certain agencies as well as certain nonprofit or aid groups or even university students or professors or other staff to help the General Assembly or whatever agency to carry out the recommendation. As Madam Chair mentioned, there are Section 1 bills. These are bills that are not codified, so you don't find them in the actual code, but they are law. And they are generally used when the General Assembly is directing a specific agency to conduct a study or to convene a work group to accomplish something. Generally, when they convene a work group, The Section 1 bill will specify the entities with whom the agency is directed to include in that work group and to collaborate in carrying out that purpose. So, for example, say, let's use the food insecurity or food desert mapping initiative as an example. It could be a Section 1 bill directing some agency that has something to do with food insecurity or benefits programs or something like the Department of Social Services to convene a work group to study or to develop and implement a plan for doing this. And it would say the work group shall include stakeholders, including, and it can include university students who have already done work in identifying or even mapping food insecurity or food deserts. It can include university faculty that have experience in ArcGIS programs. It can include computer programs and really any other outside sources that are deemed fit. Additionally, there are study resolutions, which are just a more broad method of doing it. It's not usually to convene a work group. It's more you're asking or directing a specific agency or entity to conduct a study on a specific topic and report back to the General Assembly with their analysis and their report on what they were studying. And then there are also the codified versions, which could be anything like a pilot program, which would be a temporary program with a set expiration date, usually 2, 3, 5 years, to implement and carry out something, and then it would expire after that unless the General Assembly chooses to extend that or reenact it permanently. And that usually would also include a report required. So at the end of the, term of the pilot program, the entity, usually an agency that they have administering it, would be required to submit a report saying how efficient or how successful the pilot program was at addressing what it intended to do. You could also establish work groups legislatively. So there are a lot of ways to do this, but the main idea is that you can essentially, the sky, as Madam Chair said, is the limit in terms of with whom you want an agency or the legislature or whoever to carry out and collaborate in accomplishing whatever it is the recommendation wishes to accomplish.
Okay, thank you so much for that thorough explanation of all the different types of things that we do, and we may word it such that it's a work group getting together to discuss the feasibility of something, even though we know it's feasible, just so that we're not legally demanding something, and then if circumstances change and they're not able to deliver, they're in trouble. So even if we were to talk about the feasibility, even though we know it's feasible, that report could actually be the thing it is that we're looking for. Any other questions about the process, or if we're ready to dive into some actual recommendations, I can definitely take some of those questions or comments as well. Dr. Timmer?
Thank you, Madam Chair. I wanted to draw upon what Dr. Crack asked and make a recommendation that we use the language to be more inclusive and use things like food access and when we were talking about mapping, instead of mapping food deserts or mapping food insecurity, mapping food availability. So just a semantic change, but one I think that's really powerful, that is not treating this as a problem of the poor, but as a problem of Virginia that we need to be addressing. Mapping food access is going to look a lot different than a geographic map of food deserts. I know at CNU we have some of these food deserts maps that can be shared and are very helpful, and we have students that do a GIS that could expand upon them and make them a lot more useful legislatively and for the populations that we're trying to serve.
Thank you for that. So I'm hearing a lot of energy around the mapping and then also the app. So reminding you all that we as members will have bill limits next session. So for the House, it's 15. For the Senate, it's 20. It's 20. So we might want to see about the mapping /app and combining that into a potential work group. So it's just one bill as opposed to multiples. But those are the two things that I'm hearing a lot of energy around Am I hearing that correctly? Shaking our heads, yes or no? Mapping and app, okay. So let's put those together in the top one. And then, Dr. Craig, when you were asking your question, I want to dig a little bit deeper. Was there an actual suggestion in some of the language? Did you want to include, I guess what I was maybe hearing was an assessment of all of the folks that are working on the issue and having a more centralized place for them?
I would, Delegate Price, suggest that we change the language to a mapping of the nature and extent of food access and availability challenges for people living in the Commonwealth of Virginia, as well as the potential solutions to address those challenges, to improve healthful diets, nutrition security, and reduce chronic diseases for residents.
Okay.
Delegate Price, I would like to also recommend that we define a food security partner or food access partner to take into account for the geographical locations and challenges that one entity may have to reach certain very rural or remote areas. That actually, we have 40, but we're also going to locations to where a goat is comfortable, but maybe not an 18-wheeler or a box truck.
Gotcha.
So to define a food access or food security partner, with what acceptable parameters can that definition be used?
Okay. And in defining that, do we have a suggestion?
I would define it as an entity, specifically a nonprofit entity that accelerates or enhances the work being done in food security or food insecurity within their region or their footprint that they reach.
Just want to make sure we're talking about somebody already doing the work and not a creation of something.
Right.
Gotcha.
Right. And all of ours are nonprofit organizations that are working with us. So we do 6,000 boxes a month. And we have everything from a church that has 40 members to the domestic violence shelter that services a lot of other people, as well as social services. So I think one of the qualifiers would be an existing nonprofit that is doing work in that area. And then we can further educate more.
Thank you. Mr. Oliver?
Thank you, Madam Chair. I do think this would be a valuable exercise. I would just caution the group to be careful about the parameters and scope of the project, because I feel like this is starting to become very broad. When we talk about food deserts and food access, in one sense, it's often through the lens of accessing a grocery store or a place of business to purchase food. If we start to include the emergency food system, pantries, food banks, that becomes a much larger project. And if we start to include solutions for addressing them, I think some of that may be appropriate, but that could get very large as well. So I would just encourage us to be very clear about what it is we want to learn from this and understand from it. I think the question of accessing a grocery store is probably the most pertinent for an exercise like this. Understanding the availability of the emergency food system is also important, but there's a lot of other factors that go into that, including hours of operation can be very different from pantry to pantry. There's just a lot of variables that I think could muddy the water for an exercise like this.
And so I want to ask a further question, because I remember some of the conversation of those of you all that are on the front line. The presence of a grocery store did not equate to food access if you have people that can't afford what's being sold in there. And so I guess what I'm trying to see, in a sense, there's lots of different types of maps, right? So if there was something, let's say a layered sort of something where we're looking at mountains and valleys, or we're looking at oceans and grass, where it's a map, but it can show different layers of things that are, happening in existence. Has anyone seen or witnessed anything that could encompass the various layers of reasons why food is inaccessible? Because that could also be a possibility, in that sense as well. Because I don't want to be so specific that we end up with, a true map of grocery stores in that sense, right? Because we know what people are dealing with corporate greed and what some are deeming inflation. I'll stick with corporate greed. But so I'm wondering if there's a way to word it where we capture reality, but like Mr. Oliver is saying, not something that's just celebrating the problem, something like where we can get to the actual issues. Dr. Crack.
Delegate Price, that's a good question. And so I would suggest that we look at some of the national resources available first, such as Feeding America, which does that mapping. They have tremendous resources by county, by state. So there may already be some data from across many groups. And so that's part of, I think, understanding the nature and the extent of the food access, food availability challenges for people in the Commonwealth, rather than starting from scratch. So again, I'd be happy to help out with that in whatever legislation we propose to document the extent of the problem. But I also feel very strongly that we need to look at some of the pragmatic solutions. How we define that, I think, is up for discussion.
Ms. Fagans.
Thank you so much, Madam Chair. Dr. Craig is right. And it's called the Map the Meal Gap Study. And if we are looking for any resources around Map the Meal Gap, I can reach out to my colleagues in my Research and Innovation Department to get some of that information for us.
Yes, this is a wonderful resource because right now I'm looking at the City of Newport News and just being able to see a snapshot, and it definitely tells us a lot, but it definitely has not answered all of the questions that have come up in our conversations. So I see, I'm sorry, Ms. Spencer.
So Madam Chair, I just want to make sure that I think it gets back to the question of what is it that we're really trying to figure out? Because there are different resources that track information for children. There are different resources that track information for seniors, and thinking about Meals on Wheels. And emergency services are just that. They're emergency. That doesn't tell you the actual problem or the reality on the ground. And most emergency organizations have continued needs. So they're not actually even serving to the capacity of the need in their respective communities. So I think we need to acknowledge that, to your point, the presence of a grocery store doesn't mean that people have food access, nor does the presence of an emergency supplemental source mean that there's a Band-Aid over that respective problem either. And so I think it just comes down to what is it that we're trying to find out so that we can address the gaps, because there are a number of resources, there are a number of maps, but the reality is that despite all of the presence of these things in our communities today, we still have seniors who are hungry, we have children who are hungry, we have families who are hungry and who cannot access the food resources that are in their community for some reason. And so I think it's not what's out there, it's why aren't they accessible? Mm-hmm. And I think sometimes people get focused on the mapping to the detriment of the solution.
Understood. And I remember that at the outset, we were saying, in order for us to get to the solutions, we have to know the extent of the problem. And so I don't want to get into circular logic, but I do think that there is something that we can do to build on the mapping in order to know what it is that we're exactly facing here in Virginia. So then I would turn that to the commission. What are some of the things that we would want to know that we don't have readily available? Or is it that we're looking for a map that puts all of the existing maps together into one map? So are there unanswered questions, or is it just the lack of the multi-layered tool?
Madam Chair, there's a
Yes.
comment online.
Oh, sure. I'm sorry. Yes, please. Yes, Ms. Irvine, please, go for it.
Madam Chair, thank you. This is a very important conversation, and I believe that in order for us to find the correct tool to use, we will need to do an assessment. And I don't believe that mapping will address all of the questions or challenges that we have. I believe it will require a full assessment of what the need is, where the challenges are, where the food opportunities are, and then where are the gaps and how we address those gaps in trying to reach food insecure individuals in the Commonwealth. And I know that's been an issue for many years. We've talked about this for a long time, not this group, but we have in this work. So I think it's going to require full assessment. And thank you.
Yeah, absolutely. Thank you as well. Okay. Sorry, just taking notes. And then reminding ourselves as well that if there are any unanswered questions, that can be part of the language of the directive to this group that's actually doing the thing, that we don't have to do the thing today, right? We're creating the directive for others to devote time on building out. So if there are any ideas on items that, like I said, are either unanswered questions that we want answers to, or building out the combined map of multiple maps that are already available, either of those I think would be helpful. Yes, Julia.
Madam Chair, I just wanted to clarify if it would be helpful for anyone that for legislation like directing an agency to establish a work group, not only can you specify specific individuals with whom you want them to collaborate, you can also specify exactly what you want them to study in carrying them out. So for example, if this were to be convening a work group to study and make recommendations on improving food security in the Commonwealth, you could specifically say they have to do so by identifying areas of need or low food security, and that could include defining what that means, identifying the reasons why food is accessible, develop pragmatic solutions and answers, and you can even direct them to survey specific information or specific data from any sources, other sources, or even sometimes it'll include names of individual resources. So you can get very specific in even exactly what you want the work group or the study to specifically focus on. So if there are those really targeted things about those layers, you can direct them, require them to focus on different demographics and regions. So you can get very specific in these.
And I think in an effort to get to that specificity and understanding that while the commission's name is ending hunger, right? Like that is a long-term plan, right? And so I think what we're finding is that it is such a huge issue to get our arms around that maybe if we're going to decide specific facets of the issue that we want to delve into, we can go on and decide that now so that we can get that specific within the legislation to get the product it is that we desire. Ms. Fagans.
Just a question. With this map or assessment or whatever it is that we decide to do with this particular legislation, will we be able to have, let's say, other SDOH maps be overlaid with the map that we currently have? Because hunger does not always exist within itself. So maybe is there a way for us to create something that can overlay with some other things that we currently have?
Yeah, I think that's definitely that. In that realm, it would be look into the feasibility of as opposed to the directive. So absolutely. And the other thing too, like if if before we get to solutions, hearing that we need the assessment, right? So maybe it's an assessment of the who is doing the things and how well are the things working, because just as was mentioned, it's not for a lack of trying, right? So is it program assessments? Is it finding out the overlaps that can be exploited for good, in order to spread out the work? Like it can be those types of inquiries as well. Dr. Timmer?
Yeah, and I think to your point, Madam Chair, of not reinventing the wheel, I think one question we have to ask too is what do we already know instead of trying to create new resources. But I think one thing that often is overlooked is what members of communities want, what people who are accessing the programs want from us, which is something that's not well answered on a map or even a quantitative survey tool. It's something that does require some on the ground, more in-depth and perhaps more costly work, but we can create as many resources as possible. We can expand things, but if they're not in line with what people are saying that they want, then they're not going to be utilized. So I think a big question is, what are tools that are going to be utilized by community members that need them?
I think that's a wonderful point too, because that could also answer what are some of the resources that are available now that are being underutilized. And to my delight, our presenter that's going to be coming up soon, actually, when we talked in our first conversation, it was the number of people that are using one of multiple resources as opposed to all of multiple resources, and how even better education to people about what's available, which is a very different thing than creating something new, right? But I think, Dr. Timmer, you're hitting on something that I've been thinking through, but didn't know how to exactly execute it. But I do want to just bring up that this commission itself could travel to different regions and hold town halls. But I know that you all were selected and no one told you that ahead of time before you said yes. So it could also be that we put that as something that the work group can do, if that's not something that we ourselves could do. But just putting those out there as opportunities to go directly to the people to hear from them in the region that may not be able to get on a Zoom or don't even know that we exist, to introduce ourselves and probably get a little bit more of the answers that we're looking for. Yeah, Ms. Robbins.
Thank you, Delegate Price. On item number 5 that is presented in the draft, where it talks about incentivizing grocery stores to donate unsold or unspoiled food, and it's by the VDACS, Department of Agriculture and Consumer Services. Would it be possible to include in that language schools as well? By adding the word, because they actually host the Farm to School Conference and therefore would have an extra already existing level of meetings to spread the word or spread the incentive. I think it would be a beautiful marriage, because they could be working with schools that were working with us to help this, and we could have a metric, so we could actually track the pounds of food that are being collected by schools and donated to. I actually tested this in my own community. I went to 2 or 3 schools and I asked them, if you collected the food at the end of the day, and let's say this church, Three Bells Church, this week you're going to pick up the food, and perhaps we have an app or we have an announcement that you find the closest warm meal to me, and that church would host, or that fire department would host, serving those meals for that week collected from the schools. And then it would minimize food waste, which would actually be able to be tracked, that would be appealing to other sides of governmental agencies to minimize food waste as it impacts greenhouse gases and things of that nature. So you would be able to have a metrics of weight and poundage that could also have a food security impact, a community impact, and an environmental impact.
Yes, thank you for that. I remember when I was doing research for the students that I'm working with for Better School Meals, one of the reasons why they were asking for better tasting meals was because of the amount of waste. And there's actually a website that measures that. So I don't know if it's on a map or not, but no, thank you. And to your point, that House Joint Resolution 633 from 2017, just because an issue failed to pass out of the General Assembly does not mean it was a bad idea. There's so many layers of why, reasons why, and my colleagues are laughing because we all know so many reasons why a bill can die, and we won't get into how small or big those reasons might be. But that House Joint Resolution 633 is something that if we wanted to look back into, and you know, play with the wording like Ms. Robbins is saying, that could be something that could be put forth for 2025. So that's the type of recommendation that we're looking for in the short amount of time that we have before our drafting deadline on November 25th. Ms. Fagans.
I would encourage us to also include some kind of metric that is more people-centered instead of just pounds. Because pounds does get at what is distributed, but it does not get at the impact that it's having in your community. So if we're going to do that, I think it's a great idea, but we should put in that particular legislative proposal that there's something else.
And Ms. Fagans, just because this isn't what we do every day on this level of the dais, is that like, I know I've seen some food banks have pounds and meals. Is it something like that to show that impact?
Yes, something along those lines, either meal served or like increased family served if you're looking at family household size. But definitely something to go along with that pound metric.
Gotcha. Thank you for that. And Ms. Switzer?
Because you can have pounds from cans being distributed, but you're not actually giving, it could be the packaging also that people distribute. But also wanted to follow up on one of the earlier points. I think grocery stores is one, cafeterias or schools are another, but also I do think we should look at private business. There are a number of private businesses that have been interested in and are willing to donate, but are concerned about some of the potential legal issues of if someone has a reaction or what have you. But there's a massive amount of food wasted from stores, from restaurants and stores and commercial properties as well that should be considered.
And I do remember that being part of a conversation of one of the pieces of legislation that has been attempted before, and I'm going to try and remember. There was that, pushback about the liability and things, and I think it would just be getting to a sweet spot of protecting the receivers of the product and also the givers, and seeing how we could do that. But again, if we are directing others to do it and to study it, that might be something that we're asking for them to find out as opposed to us finding the balance here. Ms. Fagans.
I would like to move on to the food is medicine or produce RX policy or draft that's on here right now. I think there's a couple of things that we may need to define and or create a working group around. I don't think that this is going to be something that we're going to be able to direct DSS to do, only because there are no concrete definitions around food is medicine or food as medicine. There are a couple of different models, and they all work for a variety of different reasons, but we need to figure out which one is going to be best for us. And then we also need to be able to define the offering, right? So whether that's going to be medically tailored groceries, medically tailored meals, or medically supportive food, which are different. What diseases are we going to be tackling with this food is medicine? And then also, what hunger relief partners or food access partners are we going to be depending on for this? I know that in the state of Virginia, all 7 of our food banks have been doing a really good job around food as medicine and health equity. But are we going to expand that work to include, more of our food pantries? We also have a healthy pantry initiative that's happening in the state of Virginia that is doing really well, but are we going to expand that to other things as well? So I think maybe instead of a directive, maybe establishing a working group to look at all of this.
The House Bill 1106 from 2022 could also be scaled down. So that was a 3-year pilot program that the Delegate McQuinn had put forward. So if we, and I'm just pulling up the language, right? So if one of the reasons was it was too large, that could be scaled down for a pilot project in order to maybe get that through. There could have also been some party dynamics that were in that. So if we use that as a starting place, right? And there was, I think I've heard of one for congestive heart failure, right? If we have one that we know is working well in a small capacity and we want to scale it up, we could do that. If we want to see what are all of the possibilities that could work and not really tailor it down to one condition, but maybe one location, we could scale that down. So there are different possibilities that could go with that. Ms. Spencer.
So I'm actually working on an effort right now at the national level around how do you code some of these healthcare medically tailored meal kind of interventions. And I just think we need to be mindful because if we're talking about ending hunger, medically tailored meals and food as medicine is not about hunger. They're related, but they are not. They have totally different components to them. And I think sometimes the conversation around hunger transitions to medically tailored meals, and the issue of just basic nutrition falls by the wayside. And so we need to be mindful that, yes, people who have chronic conditions that are influenced by their diets absolutely should have access to healthier foods, but that is not a hunger dynamic. That is a medical need or a lack in their communities that's contributing to their outcome. And so I just want to make sure, while there's correlation, it definitely expands the conversation in a direction that can get muddy really quickly, because right now there are a number of interests in this, because it's kind of like SDOH after the ACA got passed. Everything was SDOH related. Everything now is medically tailored meals. But at the end of the day, many of our children and our seniors and our families just need nutrition and are having challenges accessing nutrition. And so before we focus on just looking at congestive heart failure and diabetes, which happen to be the two most popular chronic conditions that are covered by medically tailored meals at this point in time, or medical nutrition therapy interventions. They're looking also at renal, what have you. But the reality is that you still have people who go into the hospital because of malnutrition, irregardless of a chronic condition that might accompany it. So I just want to make sure that we're not going too broad, that we leave the issue of hunger on the table.
No, I thank you for that, and maybe that is one of the ideas that we pass along to the Joint Commission on Healthcare, where some of us are working on hitting those political and social determinants of health in order to get better health outcomes. Senator Pekarsky.
I was going to agree with that. I think maybe that is an issue that is best dealt with on another commission. So thank you for your comments. But it also leads me to think about another issue of, as we're talking about food mapping, food insecurity, et cetera, a lot of these food banks and nonprofits that are dealing with these issues are moving away from kind of the canned, boxed foods, and they are making fresh produce available to families. They're allowing families, obviously, to have more of a an experience where they get to go in there and you know, pick up the things that they'll actually eat, that they want, that makes sense for their nutritional needs. So I don't know how we capture that, but to me it would be, I think it is a layer that we need to look at, because this idea of quality versus just quantity and access is really important in general, because we want to end hunger, but we want to do it in a way that's not going to cause a whole lot of other issues after the fact. Thank you.
Yes, thank you for raising an additional layer. Sorry. No, absolutely. Ooh, lots of hands. Okay, Ms. Fakins.
I actually would like to disagree. I think that this commission is very poised to handle a policy or some type of working group or this kind of issue around food is medicine or food is medicine. I also think that this commission, depending on the angle that we take, because Ms. Spencer is very correct, depending on the angle that we take, we also are very poised to handle things like nutrition insecurity, which is what I think we are getting into more. But I also want to caution us that while we are talking about produce prescriptions and fresh produce and all of those things, that's great, but there are a lot of people in the state that cannot eat fresh produce. They cannot cook it. They cannot prepare it. They don't know how to store it. So we want to make sure that we're not discriminating against one type of food or another just because of how it is manufactured or prepared. We just want to make sure that the food is healthy, right? But I do think that if we are being very intentional, because the two do happen in tandem, whether it's malnutrition, chronic disease, hunger, they all happen. So I do think that we are able to tackle some of this.
Thank you for that. Mr. Oliver.
Thank you, Madam Chair. I'd like to agree with Ms. Spencer's earlier comments. I do think it's important to note that food as medicine is, at its core, a healthcare strategy. I would advocate that we not deal with that as a commission at this time anyway. I think the senator's comments about the emergency food system working toward healthier outcomes for its clients for at large, that speaks more to large-scale population health interventions. I would just note that the Federation, all 7 food banks, have co-designed a healthy pantry initiative that has 20 different practices. Those practices have been informed by neighbors with lived experience with food insecurity, by agency partners, by healthcare stakeholders, and would be happy to share more of that information with the group as is appropriate. That may be a grant program the state would like to support at a larger level. But I think that is more of a food security strategy than a healthcare strategy once we start talking about population level interventions. Just a couple other comments on previous discussion. When it comes to incentivizing food donations, I would add agriculture to the mix. We talked about schools, we talked about businesses. The food banks, we believe there's a lot of untapped potential in the agriculture sector to rescue food that's edible but doesn't have a market and otherwise needs to be rescued. The Virginia Agriculture Food Assistance Program is a grant program established at the Department of Agriculture that helps to address that. So if we're looking at the larger ecosystem of food donations, I would just want to make sure we include the agriculture sector. And then to the work group or mapping exercise, I think there might be an opportunity, especially if we're trying to be judicious with with the bills that we introduce, to add in the second recommendation here, which is looking at how to maximize utilization of the federal nutrition programs. if we task a work group with first identifying all of the different data sources that are available to the state in assessing food access and food security, as well as opportunities to maximize participation in the federal nutrition programs, I think that work group would serve our purposes, informational purposes, policy development purposes really well.
Thank you. Ms. Spencer.
Absolutely agree on the reviewing SNAP. It's something that I know there have been a number of studies that document the low enrollment by seniors who we know are eligible for these programs. And a lot of it is due to some of the bureaucratic nature involved in eligibility across SNAP benefits or low-income subsidies or other benefits that they might be eligible for. So to your point, this might expand beyond hunger in that people who are typically low income are eligible for a number or myriad of services, but they have to apply for them individually, which actually creates burden, especially if you're someone who doesn't know how to navigate the system, don't have a computer, don't know how to navigate technology as well. And so we actually see a decrease in our SNAP eligibility in that population as a result. And I know it's something that many Meals on Wheels programs actually do when they go to drop off meals as help with enrollment in SNAP. Another thing I wanted to mention is we're talking about healthy food and just produce. Many community-based organizations, I know Meals on Wheels programs do, have a registered dietitian on staff that actually advise and work with the community because they hear very quick feedback when they deliver a meal to somebody and they don't like it. And so, you know, that's always a good gauge of whether or not people are basically ingesting what it is you're delivering. And so there are a lot of community-based organizations that are taking those steps to be more inclusive in terms of what they're serving and to be more thoughtful to the communities that they're serving, because we realize that culturally everybody doesn't eat the same things, cook the same way, or have the same preferences. And so I think community-based organizations are actually doing a lot of that incorporation of fresh and cooked meals as well.
Thank you. Ms. Fagans.
On the incentivizing grocery stores to donate unsold food, I also want to offer up a potential resource. So Feeding America, we have a opportunity report that it is meant to show food banks the amount of pounds that are left at the stores or that are available to them when they go to solicit donations from these stores. Maybe that's something that, you know, we could use, you know, a little bit more if our food banks aren't already using it, and maybe even apply it to some of our other hunger relief or organizations or hunger access partners. Ms. Montgomery.
I'm never this quiet. This has been great discussion. Also, just noted in the same vein that there is federal legislation, obviously, that helps the grocery stores currently. They get a tax write-off, they get all that sort of thing. So I think, yeah, the Good Samaritan law protects them. I mean, my organization, 60% of the 2.5 million pounds of food we distributed last year was recovered from the grocery stores. But with that comes a significant cost to have the infrastructure, to collect it, to give it. So I don't know how that would fit in here, but that an RDO is a redistribution model kind of thing, is something that kind of has been talked about as we talk, Robin, too, about how do you get, particularly in the rural areas, food into other places. So just kind of, I don't know where that fits, but I'm just throwing that out there.
And I think, so hearing that in legislative terms, it could be a bill to establish a fund for organizations that want to establish the infrastructure in order to receive those donations.
Could be a van fund or
then a budget
refrigerator fund.
That would put those funds. So just translating that into legislative terms, that's what that would look like.
Thank you.
Are there any other comments? Yes, Ms. Robbins.
Thank you, Delegate Price, and thank you, Ms. Montgomery. To build, and Eddie Oliver for something previously, to build on what, like, sustainability is what's already here. So if we want this commission and we want our state to be sustainable, what's already here. the agriculture projects that VDEX has been supporting with purchasing seconds from farmers and then distributing them. I think perhaps incorporating some of the resources or getting permission from them for them to share their list would already give us a really firm foundation of partners that are already working in this vein, to where we're not starting from ground zero and trying to say, oh, this is what hunger is. But organizations that are already working with, for example, the VFAP program or LFPA, LFPA Plus, that are already going through VDAX, already have an established large statewide set of food security partners, and that perhaps bringing them in can also help with the number 5 about incentivizing grocery stores, schools, and farmers or agriculture, entities to donate the unused food to these entities. I mean, it's already there, so it's just really a matter of asking for a list.
Right. So I do want to remind us that this is a lot of great ideas, and that is wonderful. I'm always going to welcome that, and we just need to channel them into the legislative proposals. So again, for instance, when we were talking about SNAP, right? So if you want to look at the PDF from the October 22nd meeting and then look at Oregon's Senate Bill 1585, is that something that we would like to look into? Are we looking at the work groups? Are we looking at any of the previous legislation that could, incentivize the schools, the businesses, and the grocery stores and restaurants even more? So I'm welcoming of all of the ideas. I just want to start to kind of package them into actions that we can either take for things for us to look into more next year, or things that we can put into legislative proposals for this year. Senator Pekarsky.
Thank you, Madam Chair. We must be on the same wavelength right now, because the comment I was going to make was really around the SNAP benefits in the Oregon study, and how can we maximize the structures and the benefits, as Ms. Spencer said, what can we do with some of the bureaucratic hurdles, if they are there, understanding them and trying to get rid of them, to make sure that people are taking advantage of what we do have set out in systems and resources right now. So I would definitely advocate for us to maybe begin with what we have in place, how we can make it better, and try to work up from there, if you will.
And did you have a particular starting place that you wanted to do that?
Well, like you just said, I liked us to look at this, but I do want to hear what others think about this before maybe we move into
okay, just wondering. Okay. Ms. Fagans.
I want to offer up, in that same vein, I love all of the ideas that we are presenting today, but one of the questions that I often have is, how are we going to make sure that whatever it is that we do, this work that we do, is equitably beneficial to food access partners that may represent BIPOC communities? And one of the things that we look at is, we use an equity filter when we do certain programs, or when we, go to solicit professional services for things. And I would encourage us to maybe apply some of that. I can talk with some of my colleagues to see if, I can offer that up as a resource. But I do think it's really important. I know that in the agricultural space, a lot of BIPOC farmers and local growers do not get the same amount of funding, or do not get the same amount of access to funding, because they don't have the same amount of resources from the start to access that funding. So I just want to make sure that whatever it is that we're doing, we're being equitable about it from a race and place kind of.
Sorry, thank you. Dr. Timmer. Yes, let's go to Ms. Irvine, and then we'll come back to Dr. Timmer. Thank you.
Thank you. I know we've talked a lot about pounds, meals, and people. I would like for us also to consider putting a monetary value on the work that we do and will do. I have found when I speak of 20 million pounds or 200,000 meals serving 5,000 people, let's say, that's extremely important. But we're looking at budgetary, right, challenges within the Commonwealth. And one of the things we need to do is value the monetary value on the work that's being done and then the work that can be done. So they also can see the economic value of what we do now and what we could.
Thank you so much, Ms. Irvine. Dr. Timmer, you'll have the last comment. Then we're going to take a break to hear from our wonderful presenter, and then come back to this conversation. Dr. Timmer.
Thank you, Madam Chair. And it actually was fortuitous that Ms. Irvine had the comment before me, because I was going to say something very similar. I'm hearing that there's so many resources that are available in Virginia, and our big question is not what can we do, but why, how do we reach people better? How do we reach communities of color, BIPOC individuals? How do we make sure that people are given food that is usable to them, that can be utilized very well? So my thought was, beyond a working group, like, can we incentivize groups that are already doing this work, or university students to help produce the data? So maybe a fund that is helping us answer those questions. So that moving in, we can move forward with legislation that has backing behind it. Yeah, that's it.
No, I absolutely. Point well taken. I am quite excited because of our the energy behind our conversation. I am also excited about what we are about to hear. Funny enough, networking is weird, but Congressman Scott heard about our commission and was like, I met this guy, you gotta talk to him. And I was like, okay. And so, sometimes you just make a call just to say you did what you said you were gonna do. But in our brief call, I learned so much. And so I'm really excited to have Dr. Chris Barrett join us. I am gonna read some of his bio just so that we don't embarrass him, but set him up in a good context to know why I am so excited. But he's an agricultural and development economist at Cornell University. He's a professor of applied economics and management and an international professor of agriculture, as well as a professor in the School of Public Policy, a senior faculty fellow of the Cornell Atkinson Center for Sustainability, and then a faculty fellow at the Cornell Institute for Food Systems. That list continues. He is co-editor-in-chief at the journal Food Policy and works with other publications as well. He has won numerous university, national, and international awards for teaching, research, and policy outreach and public service. He has his more than 375 publications have been cited more than 62,000 times. And so instead of citing him as one of the top 5 scholars globally in the agricultural economics, development economics, food security, poverty, and resource economic fields, we're bringing him directly to speak with us. And I thought one of the most wonderful things about his resume was that he has supervised more than 100 graduate students and postdocs, many of whom now serve on faculty and staff at leading universities, really paying it forward there. So Dr. Barrett, if you will unmute, and we are excited to hear from you with whatever you wish to share today.
Well, thank you very much, Delegate Price, for the overly generous introduction. But it's a real pleasure to get to visit with you all today. And I apologize for joining late, but the part of the conversation I was able to hear is incredibly stimulating. I applaud you all for tackling with such seriousness and passion such an important issue. I trust you can see my screen now, correct?
Yes, you are good to go.
Okay, excellent. So I was just asked by Delegate Price to give a very quick summary of broad figures, broad patterns around food security and food assistance in the United States. And I'll also draw on some very specific work that we're doing here in upstate New York. This is work with my faculty colleague from the Division of Nutritional Sciences, John Hodnott, and several of our students. So I think the first thing to recognize is broad patterns nationwide. Although I was born in Virginia, it's been many years since I lived in Virginia, so forgive me, I don't know enough of the particulars of your state, but I'd hazard the guess that it probably follows very similar patterns to what we see nationwide, what we see here in upstate New York. And that is that we consistently have about 10 to 15% of all households being describable as food insecure. I won't get into the technical details of how we measure that, but roughly 1 in 7, 1 in 8 of our fellow Americans is struggling to be able to feed their family a healthy meal every day. And it's not equally distributed. That, I think, is one of the crucial things to take away, that there are very predictable patterns of which communities, which subpopulations are most likely to suffer food insecurity, and especially to suffer chronic food insecurity. We know, for example, that households with children, as you see on the left, households with children, especially single-parent households with children, depicted in the green line and the red line. This is showing you food insecurity rates since 2001. They are just much more likely to be food insecure than households without children or households with 2 adults. And the single biggest group suffering food insecurity in the United States are households run by a single woman with children. Roughly 1 out of 3 are suffering food insecurity in any given year, which is just intolerable, I think, is the right descriptor for that. It's also very unevenly distributed across different ethnic and racial groups. In particular, Black and Hispanic households suffer food insecurity at a much higher rate than do households that are even Native American, but especially white households that are not Hispanic. You see that graphic on the right, where it's 2 to 3 times higher rates of food insecurity. So these are consistent patterns over time. Notice this is not some aberration that has just emerged in the last few years, nor is it a pattern that used to be much more egregious in years past and that is markedly improving now. These are structural conditions that have described the United States for at least the last quarter century. And if we went back further in the data, I think you'd find that that goes back much further indeed. So that's the basic pattern of food security. Those were snapshots at a moment in time. So without getting into the details of how those data are collected, they're just asking, as of December in each year, who is and is not food insecure. Now I'm going to shift in this slide to a slightly different question, and that is food security dynamics. Who is food insecure over a period of time? Here, along with Professor Hodnott and a former student of ours who's now at Notre Dame, we figured out a method to be able to track over extended periods the food security status of households. This is work that is just published. And there are a couple of key takeaways to understand about food security dynamics in the United States. The first one is roughly 2/3 of American households never experience food insecurity. So we use data from 2001 to 2017. So it encompasses the Great Recession. And in that time, almost exactly 2/3 of households never had a single instance of being food insecurity in the biennial data. We see these households every 2 years. So most households just never have the personal experience of food insecurity, which I think is really important to internalize as we think in particular about popular support for food and nutrition security programming. If 2/3 of the population never experiences this condition, they are experientially less sympathetic to the very real needs that neighbors might have. The second key point is that roughly half, a little bit more than half, of all food insecurity spells, meaning a period of time in which a household is food insecure, those are short. They're 2 years or less. I think the right mental image to have in your mind is that somebody is chugging along, they're doing okay, but then they lose their job suddenly. And when they lose their job, they've lost their income and they don't have adequate savings to be able to tide their family over for an extended period. So they burn through their savings in 3, 4, 5 months. And then when they're still looking for work 6, 9 months later, suddenly their household is food insecure. And they find a job again, but it took a little while to find a job. And their food security depends upon having steady employment with decent remuneration. So that is, at any given moment, about half of the people who suddenly become food insecure are going to exit food insecurity within a couple of years as they find a job. But there's a period of real hardship in there. It's not long, but it's very real. And then we have roughly a sixth of our population. Most of those who are suffer food insecurity at any moment in time are suffering what we often term persistent or chronic food insecurity. They are food insecure for more than 2 years straight. And that's a long time, especially for families with children. You saw that the rate of food insecurity among families with children is much higher than the rate of households without children. And the main driver of these phenomena is poverty and jobs. And if you look at the plot I have here that shows on the bottom in the lighter gray households that remained food insecure from the prior 2-year period, those that were newly food insecure in the darker gray, notice the big jump in 2009. When the Great Recession hit, it suddenly thrust a lot of people into food insecurity, especially people who had been newly food insecure. They lost their jobs and it took them a while to find replacement. And that is a very regular feature of food insecurity in the United States. It follows the macroeconomy. When employment is tough, when real incomes are down, food insecurity increases, and more people are becoming food insecure as they lose their jobs, and more people who were food insecure remain food insecure as they struggle to find new jobs and exit poverty. So these are important features of food security dynamics in the US. Then, how do we cope with this as a society? We have quite a generous program of government food assistance, food and nutrition assistance, coordinated out of USDA. But the thing that really differentiates the United States from all other high-income countries is the scale of our private food assistance. We rely much more on the food bank, food pantry network than is true of any other high-income country in the world. And that private food assistance network is entirely charitable. There's a bit of assistance that comes from the federal government, things like TFAP, but mainly this is donations from businesses and especially from private individuals that make our food bank, food pantry system work. Our publicly supported programs, the public food assistance programs, are much, much larger, however. So here I show you just data from the USDA's Economic Research Service describing food and nutrition assistance spending in the most recent fiscal year for which it's reported. Roughly 2/3 of the federal support for nutrition assistance comes in the form of SNAP, the Supplemental Nutrition Assistance Program. And that's roughly 9 times as much as everything that goes into food banks and food pantries. So while we rely as a country much more on the private charitable food assistance network than is true of other countries, it's also important to keep in mind that it is still dwarfed by the public system. SNAP is the gorilla in the room. SNAP is our main instrument for helping families that are struggling to feed themselves an adequate diet. This is the main instrument we have for helping them do that. And roughly 15% of the US population receives food assistance. That is on the same scale as the share of the population that's food insecure. It's not a perfect mapping. There are food secure households that are on SNAP, whether that's because SNAP helps tip them out of being food insecure, or it's because they teeter on the edge and they are getting food and nutrition assistance, even though they're not food insecure, is a heavily debated question among scholars, but the point is that it's largely the same population. It's the population in the kind of lower quarter of the income distribution in the United States that is food insecure, and that is roughly the same population that draws on these benefits. And one of the main reasons why we use SNAP as the main instrument for combating food insecurity is that it is much lower cost per beneficiary per dollar of food received than our food banks and food pantries. Food banks and food pantries are hugely important, but they are standalone entities. SNAP is merely leveraging the commercial retail system. So all the bricks and mortar costs, all the staffing costs to operate food distribution through a commercial retail network, grocery stores, even convenience stores, that's all covered in the run of business, while food banks and food pantries have to cover their costs. So that's the simple reason why SNAP is lower cost. Here in upstate New York, we have built I think, unique data set where we combine all the administrative records on every SNAP participant in a 6-county region here in what's called the Southern Tier. So the Pennsylvania border north through Ithaca, where I live, encompassing the cities of Elmira, Binghamton, and Ithaca, but a largely rural area outside those 3 small cities. We've built this data set that runs from 2017 to 2021 that has every SNAP transaction, every time a participant gets an influx of funding onto their electronic benefits transfer card, their EBT card, or every time they redeem EBT benefits at a retailer. And we have the universe of every food pantry visit in those 6 counties during the same time through the food bank of the Southern Tier, the food bank that services that 6-county region. And we've been able to statistically match those records. So we know this population of roughly 225,000 people in the 6-county region. We know who uses SNAP, who uses food pantries, who uses both. And the key thing that comes out of this unusual opportunity to study at very, very precise resolution, the main thing that comes out of this is that about 40% of the population in this area receives some sort of food assistance at least once over the course of that little more than 4-year period for which we have data. Roughly 25% of the population only ever use SNAP. Roughly 10% only ever use the food pantry. And to me, the shocking part was that only about 5% of the population in this 6-county region uses both food pantries and SNAP. We often think of we have these 2 instruments to help address food insecurity in our communities, but in fact, there's not nearly as much use of both of those tools jointly as we might expect, as we might hope. Roughly 75% are using SNAP of those who get any food assistance. So again, SNAP is really the workhorse here. Another striking thing is that we find that these are mainly single adult households. So it's a lot of homeless individuals, poor students who are struggling to make it through community college and pay tuition and rent and just don't have enough left over to buy food routinely. So we have a fair number of food pantries set up at community colleges and 4-year colleges in this area. And we're surprised at how high that rate of service is. We find that about 1/3 of the food assistance users have children, almost exactly matching the population nationwide that's food insecure, that is the single families with children, and about 60% are female headed. So the food assistance recipient population is overwhelmingly female and disproportionately children. This is the population that our food and nutrition assistance is serving. It is something not experienced by most of the population. Just like food insecurity isn't experienced by most of the population, most never go to a food pantry and never use SNAP. But for those who depend upon it, it's really important. And one of the striking things we find in these data, our data start in 2017 and run through 2021. So the lockdown period of March, April 2020, when COVID hit, and suddenly we're curtailing lots of operations, people with consumer-facing jobs in restaurants are suddenly out of a job. We found this big spike in food pantry use during that period, not surprisingly, because lots of people got thrown out of their jobs suddenly and they can't get on SNAP in just a few days' notice, so they turn to food pantries. But for those who were already on SNAP, there's no measurable change in food pantry use. SNAP was the shock absorber during that period. It really worked. It helped to buffer a large number of people who must have lost their jobs. We don't know exactly what was happening, but people who were already in difficult situations that almost surely got worse, SNAP helped keep them from having to rush to food pantries when many of their neighbors who suddenly were in hard times did rush to food pantries, which met their needs somehow. It was a Herculean effort by those food pantries. So those are the key attributes that I just wanted to describe to you about both food security patterns and food assistance patterns nationally, and then just a little bit of a more granular insight on the region in which I live, which I think probably mirrors a fair amount of Virginia, kind of this hybrid of rural and small cities, a mixture of food pantries served by food banks, as well as a SNAP program that's much larger that is serviced through the commercial retail network. I'm happy to answer your questions. Thank you very much for your interest and your time.
Thank you so much, Dr. Barrett. Are there any questions from the dais? Seeing none, we want to thank you so much for your time, your expertise, and I will assume your open line for us to call should there be any questions that do come up after the meeting.
Absolutely. Here, I'll put back up my email address in case anybody wants to reach out, or my telephone in case you want to send your staff to me. Thanks.
Thank you so much, Dr. Barrett, and good luck to you and all of the good work you all are going to continue to do at Cornell and around the world with your travels. So I think knowing that underutilization that he just described could also be happening in our area, that I'm very interested in adding that to whatever inquiries we're hoping that the work group will do. And I suspect that our demographics would look a lot the same in parts of Virginia. So really concerned about what it looked like from 2009 to 2015, I think is the time that it took to kind of level back out for some of those new families. And my comment, not the commission's, knowing the economic situation that we might be headed toward, what Virginia might be experiencing coming up in the next few years. I think the work that we are doing and the work that those are on the front line are doing is very important. And so I do think his words might have pushed in my mind a little bit of urgency for us to get that assessment of what we have and how well is it working. But I know that there were some other folks that had questions or comments before we heard from Dr. Barrett, so I do want to jump back into that. Delegate Cousins.
Thank you, Chair Price. So I did some quick research on what Virginia sort of already has in place for excess food donations, and so there is a code section. It's section 35.1-14.2, which already allows for grocery stores, restaurants, convenience stores, other businesses that sell food to donate those, any excess food to charitable organizations. So if we're talking about maybe incentivizing more of those donations, there is a food donation tax credit that is also in our code, section 58.1-439.12:12. That's a long, long section over there. But it provides tax credits for farmers who want to donate excess food to charitable organizations. So I wonder if we can somehow, within this tax credit, perhaps look at expanding that to grocery stores, restaurants, convenience stores, other businesses like that.
So because this is a very concrete idea, I would like to stay on this for a moment and might be able to get us to our first voice vote on support of a recommendation, because the passion that I hear from our member might also indicate that she might have a bill space for said item. Are there any comments or questions as it relates to potentially adding or expanding to whom those tax credits could go? We do understand that that would also have a funding mechanism probably with it, because we're not trying to hurt what the farmers already have, but adding to it and extending. Mr. Oliver.
Thank you, Madam Chair. So that would be my concern. I think the delegates' proposal is well taken. I think we would want to try to ensure there are a tremendous amount of grocery stores, other businesses already making donations to food banks and the charitable food system. I would just want to ensure that whatever we do incentivizes additional, right? So if all of a sudden these businesses are getting incentivized or rewarded for baseline what they're already doing, I don't think that's going to move the needle for us in a meaningful way. And the tax credit being leveraged toward farmers is really, again, to incentivize an area where we aren't currently getting a lot of donations. The food bank system has worked very hard to tap all of the available donations from the retail and manufacturing sectors. That's not to say that we have fully tapped it, but if we're looking for the biggest ROI, we would just need to try to ensure that this is somehow value add on top of what is already happening, I think.
Point well taken. Any other feedback? Senator Prokopsky.
Yeah. Sorry, that's my concern as well. I don't know enough about the federal benefits that are coming. I think somebody mentioned that, to know whether, us kind of putting in more benefits would actually have the desired effect. And so that makes me a little bit uneasy on saying this is the right approach, because, as we're hearing, if folks are already doing it without those added benefits, thank you to them. I don't know that I would want to be supportive of that, but I think I go back, especially after this presentation, to the SNAP benefits, to understanding what is the utilization of them? What are the hurdles in front of families? What are the barriers to access? What are the community points where we need to be ensuring that this information is getting out to them? Can they qualify virtually? Is it a language barrier issue? I don't know enough about that, but I think that is something that I think it would be helpful for this commission to understand. So going towards the idea of the work group, I still feel like that maybe is probably one of the best pathways for us, and a priority that should probably come out of the commission.
Okay, and I do want to kind of flesh out some of the different things that we've spoken about as it pertains to the work group. So we had talked about the work group looking into Virginia's food access and food availability, and kind of doing an assessment of the agencies and entities that are doing work within that. Then I think separate, what we have is something that could be based off Oregon Senate Bill 1585, which was a deep dive into SNAP usage and utilization. Could we keep that as two separate in your mind?
I mean, I think we could, yes.
Okay.
Yeah.
I'm just thinking because the work group,
manageable.
manager. And then also there might be, like DSS and some of the other folks that have a heavy hand in how SNAP translates from paper to people, that they could just do something, to get us a better picture of SNAP usage. And maybe that is where we could also have that inquiry on potential underutilization of SNAP and, are there any comments or responses to that as a potential legislative priority coming from this commission, or two legislative priorities? Mr. Oliver.
Thank you, Madam Chair. This is where I would defer to the legislators. Other states have expanded similar work groups to look at participation across federal nutrition programs. I think there's a lot of cross-enrollment opportunities the state isn't taking advantage of that, again, very low cost, but would have a huge impact. If we're going to task a work group with looking at strategies for expanding participation in SNAP, would we consider broadening it to federal nutrition programs writ large? Is this an opportunity for us to do that, or is that a build in the future?
Yeah, and I am not speaking for everyone. I'm just saying for my response, it could be playing with the language of the task force specific to the federal programs, but still keeping the mapping, the full assessment, the program, maybe program assessments and management, evaluation, maybe that. So I'm still seeing task force like the Oregon bill and the federal programs and their impact in Virginia a little bit separate from the original work group that we were talking about. Mr. Oliver.
Thank you, Madam Chair. Just to respond to that, I very much agree. I think that two work groups are needed. The first, to your point, is to inventory existing data that's available to evaluate food access and availability and identify gaps. So that's sort of the academic exercise of better understanding food access in Virginia. The second working group is where my question comes in of looking at expanding participation in SNAP. Would we want to identify other programs like WIC, the Senior and Child Farmers Market Nutrition Programs, others that might have similar strategies in terms of reducing administrative barriers, doing cross-enrollment across agencies? I think a lot of those same strategies could be worked in to what we would think about with SNAP could be applied to other federal nutrition programs.
Yeah, I think that's right. That the chart that we just saw for all of the programs that were under USDA, SNAP, Child Nutrition Programs, EBT, WIC, and then the others, I think that makes a lot of sense. And then I guess the only other question then, if we did USDA program benefits, like a task force on maximizing USDA sponsored or, that USDA program benefits, does that encapture everything that you all are seeing in the utilization, or are there other sources of federal assistance that you would want to have added as well? Dr. Craig.
Thank you, Madam Chair. I agree with what's been said. The USDA administers, actually it's taxpayers' money that pays for it, but USDA administers 16 federal food and nutrition assistance programs that people in the Commonwealth of Virginia are entitled to depending on the eligibility. So SNAP is certainly the largest, and it's important, as Dr. Barrett has pointed out. Then we've got the school meals piece. I was actually kind of curious, and I'm glad Dr. Barrett is back on there. You didn't really mention the school meals and the WIC programs, which are the second and the third largest of those USDA programs. So you mentioned there was a large proportion in the southern tier of New York State of women, single households with children, but did you also inquire about those maximizing the benefits of those other programs?
Yeah, thank you very much for that question. We don't actually have the administrative records on WIC participants in New York State for reasons we don't quite grasp. The New York State Department of Health, which administers WIC in this state, separate from the state agency that administers SNAP. The Department of Health wouldn't grant us access to the administrative records, so we couldn't do that matching. So I can't tell you how much overlap there is between SNAP use, food pantry use, and WIC use, for example. But just as a matter of scale, your observations are spot on for New York State as well. I mean, SNAP is much, much larger than the school meals program, which is larger still than the WIC program. WIC utilization, WIC uptake is based on survey data, much lower among likely eligibles than is SNAP. Most people conjecture that's because the burdens of recertification and check-ins are just bigger than they are for SNAP. So it's more of a nuisance for mom to get all the paperwork filed and take kids in to check them again, et cetera. So we don't see the same rate of uptake among WIC, even though it's an incredibly effective program. The benefit cost ratio on WIC is extremely high. It's a really good use of taxpayer money, but it's often hard to convince moms to enroll their kids and themselves in those programs. And this is where, if the overlap with food pantries were larger, food pantries seem to offer a nice way to increase the visibility and perhaps facilitate enrollment and reaccreditation in those programs. But just we find so few people who are doing both that we clearly need other avenues to promote more use of WIC and SNAP among eligibles than just relying on promoting them through the food pantry networks.
Thank you, Dr. Barrett. I would just mention that we may have access to those records for WIC at the state level in Virginia, so we should look for that. We do have, through the Virginia Department of Social Services, access to SNAP participation rates from 2021 to 2024. So again, those are existing data that need to be compiled so we can then make a more informed decision about the strategies to reach the people we want.
Yes, Ms. Robbins.
To speak to Mr. Oliver's point and Ms. Fegan's point earlier with regard to the legislation, item number 3, with the working group, is there a possibility to incorporate in the language the needs assessment for the community so we can capture the diverse needs in food equity, food justice, different ethnic groups, different communities? You're capturing enough information there that with the working group to just add another question or 3 could give us more data so we can ensure food equity, not just food security.
Yeah, absolutely. And I think that could probably be a part of the task force and the work group, and making sure that we're having that lens with all of the inquiries that we're making. Awesome. Dr. Craig.
I would just note that the USDA in the last 2 years has developed a more comprehensive definition of nutrition security, which contains really 3 components. First is people get adequate amounts of food, which is the quantity piece. People have high diet quality, according to the Dietary Guidelines for Americans, and it also addresses health equity for people who are, historically and chronically experienced chronic diseases and food insecurity. So I think if we go from the food security, I know we've got the 4 definitions that Dr. Barrett pointed out, but we also have this more broader concept. Perhaps we can work that into our legislation, and that will address the equity concerns of our delegate Robbins. Oh.
Yes, thank you, Dr. Timmer.
One thing that hasn't been discussed is the Hunger Free Campus Grant Program. And as somebody who has been working to build a food pantry on our campus, we've done some preliminary research, and it looks to be like that college students are definitely an invisible hungry population, but part of it is an underutilization of SNAP. So in order to kind of expand that, and in the interest of not having more legislation, we also could work college campuses and college students into the language of the legislation in terms of asking questions about extending SNAP benefits and how we can make it more accessible to college students.
Thank you for that. And Delegate Rome's Senate Bill 318 was continued to 2025. I do believe that she has mentioned wanting to continue to work on that. So Dr. Timmer, I'm going to get you and Senator Rome in touch with each other to see if there are any updates to the legislation or maybe a little bit more specificity that can be done, or even a scale down to start with maybe a few, if that was the issue for why the bill was continued. Delegate Cousins.
Thanks, Chair Price. So I carry the House version of this. Yep. So I know. So we started off introducing bills both in the Senate and the House that would have established a grant program for colleges and universities to get money from the state to address food insecurity on their campuses. So that was then, I hate to say watered down, but kind of watered down, watered down to a study for Chev, or to a survey. So Chev was responsible for surveying colleges and universities just to get more data and information on food insecurity on college campuses across Virginia. They are working on their report. The deadline date was November 1st, but I know they're working on compiling all of the survey results into a report. So I think the next step there, at least what I'm considering, is just waiting for that report, which hopefully we'll have, in a few days, and then determining maybe what legislative avenues to take at that point.
So, because we're all here now, and I would love to get us our first voice vote, if there were concerns previously, it sounds like several things. Let me get this out. It sounds like Virginia has come a long way since Delegate Simon introduced House Joint Resolution 633 in 2017 when it comes to incentives for grocery stores to donate, right? So maybe we put a pin in that, and if we want to expand that without hurting the current program, that's something that either the work group can look into, we can look into, but for future. So this one item that our delegate might have, maybe this is a continuation of the work on the Hunger Free Campus Grant Program. And with everything that Chev has going on, if they're not able to get the report to you by our drafting deadline of November 25th, let's say if we don't have it by like tomorrow, maybe there's something that Dr. Timmer and you and Senator Rome can get together to at least do the draft request for to get it going with the attorneys so that we don't miss out on the opportunity. Then the report is released, we can fine tune it based off the specificity that Chev has found. But I met Dr. Timmer at a social justice conference, having advised a student that was working on this. So I know that there's at least C&U data, if not, more Virginia-specific data. So I am putting that out there as a recommendation that I would like for us to vote on. And so I'm going to look to our clerk to see if that is a recorded individual vote or if that is a voice vote. It is a voice vote. So all those in favor of continuing the good work that Delegate Cousins and Senator Rome have done on the Hunger Free Campus Grant Program, please say aye. Any opposed? And so that is, the ayes have it. It was not unanimous, but the ayes do have it. And so that is our first recommendation. See, look at that. We have one in the book. So thank you for the work that you all will do to get us there. Is there any, well, let me see. We've had significant conversation on the idea of the work group, and we will have a few bites at the apple. Let me back up because something that you all might not know. So if we vote on a recommendation in concept today, that is basically saying that we want the commission to move forward with our Department of Legislative Services, which are our attorneys, where we get Julia and Hannah from. They are the ones that then draft the legislation and work with a member in order to get it into the form of a bill. Then we as members receive that back as a draft, and then we can fine tune the language, and then the bill gets introduced. And then even in the process, after it's introduced and we go before in the House, a subcommittee, further amendments can be made, and amendments can be made even up until when the governor sends back an amendment before signing something. So there are ways to amend it. So I don't want you all to think that you're being left out of the rest of the process, but this is something that will help us get it going. And so Delegate Cousins would then take this idea that we just said, that we just voted on, will work directly with DLS to get a bill. And then at the December meeting, we can have input, with your permission, we can have input on the wording of it to see if there are any changes that you all would make based off your expertise. So we're kind of voting on ideas now that will become bills. So I don't want you to feel like you're lost in the process. With that said, this idea of the work group that would look into an assessment of the programs and the resources that we have here, the potential for a mapping, the potential for an app, and some of the different ideas that we've thrown out. Does anyone feel strongly in suggesting that as a motion for us to have that as a recommendation coming from the commission that would like to get on the microphone and say that as a recommendation? Ms. Fagans.
I recommend that we establish a working group to do that mapping.
And all of the other things that we just said. Yep, okay, great. And so all of those in favor of the idea of the work group and working on these items will please say aye. Aye. Any opposed? And so that was a unanimous recommendation, and we will find a sponsor and a home to work with DLS on that one. In addition, I've heard energy and passion behind establishing a task force that would look into maximizing the federal-based programs out of the USDA and its utilization in Virginia. Would anyone like to speak to that? Dr. Craig.
I make a motion to establish a work group to examine the opportunities to maximize the benefits of federal food nutrition assistance programs, such as SNAP and WIC and others, to people throughout the Commonwealth of Virginia.
Thank you for that. Can I get a second? Ooh, second. Thank you. Okay. So it's been moved and properly seconded. We're just going to pretend like the first one was. It's been moved and properly seconded. All those in favor of the task force specific to the federal programs and their assessment of utilization, please say aye. Aye. Any opposed? And so that is a unanimous recommendation of the commission as well. So our meetings usually end at 12. I do want to be respectful of your time and all of the wonderful people that work to get this meeting in front of you at home, but also running so smoothly here. So I do want to put us on a clock. But with that, Delegate Owen.
I'm sorry to hold us up from breaking, but...
No, not holding us up, just meaningful usage of the next 10 minutes.
Understood. Just want to make a comment on the one we voted on that I voted against. And I voted against it because we're talking about giving grants to public institutions, and I believe our public institutions have plenty of funding already to deal with this publicly. But we're excluding the private colleges that don't have those same resources. So I would just say to the freshman of the year price that maybe you think about that as well in your bill. So Thank you.
Duly noted. Thank you. Were there any other points of discussion, previous bills that have been put forward or that were on our agenda, or anything else that we would want to discuss as we just keep in mind that the drafting request deadline is November 25th, and that will pass before our next time together in December? Yes, Dr. Crack.
Madam Chair, given our earlier discussion about food as medicine, I agree with the point brought up that it's not intended to address hunger or food insecurity. But it does have a great deal of momentum and tremendous funding right now. We're not quite sure what the future of that will be with the next administration. So I think particularly for the state of Virginia, if we could maybe set up a work group or a task force to look at the opportunities for implementing the various food as medicine strategies to people who are eligible and who may benefit from that in Virginia, just because I think it's so important at the national level and it's got momentum at the state level. We've got to have something around food as medicine.
So I appreciate that, and I will note, without speaking for her, I do believe that Delegate McQuinn may be interested in moving forward something beyond a work group into action. So what I can, let me think through. If we can, I'll put it like this. So if there is interest within the commission in expressing our support for a member of the General Assembly to move forward in taking action on food as medicine, please say aye. Aye. Any opposed? Then I think I can express our commission's full support of whatever she or someone else might already have in motion in bringing back the House Bill 1106 without speaking for her, but just being able to speak for ourselves that we are interested in supporting that. Julia.
Thank you, Madam Chair. I also just wanted to note that if anybody was interested in seeing more comprehensive analyses on Produce RX or food as medicine programs, the precursor to the 2022 bill was legislation that directed the Department of Social Services to conduct a study or a report on creating such a program. It was HB 2065 in 2021. And after the October meeting, the full report was posted on that meeting webpage. So if any of the members were interested in reading a bit more and seeing what they might have concluded, that is available on the meeting webpage.
Thank you for that reminder, Julia, because I think what I can also do, if we find that there are any members that have openings, we might be able to look through that report for any solutions that could be turned into bills. I want to note also, I had asked a question I think it was based on my conversation with Dr. Barrett, but somewhere I learned that there were not required nutrition courses in medical school. And I was stunned into silence, which does not happen often. And so we do have a note that Julie and Hannah were able to look that up. And it says, while it appears that most medical schools offer elective courses relating to nutrition, most schools do not appear to require any nutrition competencies. And to the extent that nutrition is taught, it is often taught as part of another class or competency. And so that might be something that, at least within our public institutions, we could look into the possibility of either, if courses are already available, seeing what could be done through law or regulation to mandate them, and if they're not already available, seeing what could be done through law or regulation to mandate that they be created. So I just wanted to close the loop on that. Julia.
Madam Chair, on that note, I also have a little bit more specific information that wasn't included in that little blurb. specifically looking at University of Virginia's medical school, Virginia Commonwealth University's medical school, Eastern Virginia Medical School, and Virginia Tech School of Medicine. There isn't any data on an actual hours requirement of nutrition education or classes that medical students are required to complete in order to receive their MD. And on the average in the United States is 21 hours are required, but over 70% of medical schools require less than 20 hours over all 4 years. Virginia Tech does include in certain far broader concentrations that they touch on nutrition, but again, that's not an hours requirement. So that could be something that they can focus in on, is trying to figure out a way to impose or incentivize or encourage an hours requirement to be imposed.
And I am sure that there is a lobbyist somewhere that is watching this that I will hear from, and we can have that wonderful conversation. But I thought it was absolutely bonkers that it not be required when so many of the ailments that folks see could be based in malnourishment or in some way, shape, or form be food-based. Ms. Robbins.
The Byrd Medical Center did research on a food RX program already, and had done a pilot program with some partners of ours in West Virginia, like a cancer food box or a diabetic food box. So rather than reinventing the wheel, perhaps reach out to the Byrd Medical Center and where their funding source came from to conduct such a pilot program. It was a really big hit, and it appears that it's going to have another funding year to come. So I think that we could probably utilize that resource as some wisdom and knowledge to go forth and build on.
Yeah, absolutely. And we have in the Hampton Roads region, we have Centera as well that is working on, and I think there's a specific to patients with congestive heart failure, but here in Virginia, we have a few as well. So looking forward to see what Delegate McQuinn or some others might be able to do through either budget amendment or legislation with that. Were there any, did I see another hand? Any other questions? Yes, Mr. Oliver.
Thank you, Madam Chair. This is a bit of a process question, but as bills and amendments get introduced for the upcoming session that we feel like are relevant to the commission, what is going to be the way in which we might or might not consider them moving forward? Are there going to be future opportunities to endorse bills or amendments that come forward that we haven't been proactive about? How might that work?
Yes, so we are by definition an interim commission. So we have one further meeting in December where we can kind of look at the drafts, hopefully maybe, or I guess more specifics, if not an actual draft, for the things that we just voted on to endorse today. From my experience, a lot of the legislation that is going to be introduced may not be introduced until closer to the deadline of the first day of session, or even after, because there's some instances where we can introduce bills after. So I don't know that we will, as a group, be able to meet and discuss that. But I do think I would encourage every single commission member to stay abreast of legislation that has been introduced, especially for any unintended consequences, because we have lots of great ideas, but you all are the ones that would know whether they are truly great in implementation. And so we would offer that feedback by way of, in the House, we have public written comment through HodSpeak. We also have the availability on HodSpeak for you to sign up to speak through Zoom, just like our members join us today to give testimony. You can contact the sponsor of the bill to be an expert, to speak in rooms just like this one for when they introduce the bill. You can send emails, have conversations, come meet with us. So on an individual basis, the sky is the limit. And also you can mobilize your members. If you are a member organization, for each of your members to also reach out out. And then after session, this body, as the commission, will start to meet again. And that's where we can start picking up and looking at 2026. And so it may not be as satisfying of an answer, but because we didn't even get established until July of this year, we've been kind of trying to catch up a little bit. But that drafting deadline does still stand until November 25th. So if you, as Mr. Oliver, had an idea that you wanted to reach out to a delegate or senator about, you are absolutely welcome to do that, as is anyone hearing the sound of my voice. We are able to turn, because of the magic of DLS, we are able to turn 3-sentence emails into legislation. So if you have an idea, they will let us know if it's constitutional or not. They really do work a lot of magic, but that is usually where bill ideas start. It's from the people that are out there doing the work, whether you're on the front line or whether you're a constituent that is actually going through an issue and you know that there needs to be a change. Our emails on both sides of the aisle are open for those ideas. That was a very long answer, but it is because there are so many options for folks to engage. Yes, Dr. Crack.
Thank you, Madam Co-Chair. I would just like to ask what the status is, particularly of the universal school meals legislation. I know that that was an issue very close to Delegate Danica Rome's heart, and working toward that. It did not get funded, I believe, last year. Since next year, 2025, is a budget year that can actually reallocate existing budget amounts in the state of Virginia. I'm just wondering kind of where we are, if you can just share if that is kind of something we can propose now or just if that's on the back burner.
No, I think it would be impossible for you to stop Senator Rome from fighting for universal school meals. Because I do not want to speak for her, I am not sure which route she was planning to take, but that is something also that we could take a vote on if we would like to have the commission endorse and support her continuing that work. So as I'm hearing that head shake yes as a motion, is there a second? On that second, okay. The motion to express our support as a commission for the continuation of the work to achieve universal school meals is on the table. All those in favor, please say aye. Any opposed? And so that is, the ayes have it. That was not unanimous, but the ayes have it. And so we will definitely have that on record here, and we can express our support by way of majority to Senator Rome as she continues that. And I believe, oh, don't kill me, there is somebody on my side in my chamber that was working on that as well, and we'll make sure that that they are continuing that work as well. Were there any further comments or questions or concerns before we adjourn for the day? Seeing none, I want to thank you for your time. We will have a December meeting so that we can close some of the loops on some of these ideas before we go into session. And because there will be some votes with that, it will be in person. We were hoping for one more online meeting, but we have to be in person in order to take those votes. So thank you for your time. Thank you for your attention. We are always open to public comment. And so if you see our information on our committee website, please continue to reach out to us with your concerns, your questions. We thank Dr. Barrett again for his time and attention and his good work in this area. And with that, I will entertain a motion to adjourn. It's been moved and properly seconded that we adjourn this meeting of the Commission to End Hunger. All those in favor say aye. Aye. Any opposed? This meeting is adjourned. Thank you.